Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about hernias in babies. What is a hernia? A hernia occurs when part of the intestine pushes through a weak spot in baby's tummy muscles. The term herniate means to protrude through an opening in the abdomen. Babies can be born with various types of hernias. An inguinal hernia occurs in the groin area. When it bulges through the diaphragm opening, it's a hiatal hernia. An umbilical hernia appears around the belly button. Let's look at these various types of hernias. An inguinal hernia occurs when parts of the intestine push through weak abdominal muscles in the groin. It's a visible swelling that comes and goes. If it becomes hard and painful, surgery is the only treatment. A small incision is made in baby's groin and the contents are pushed into your child's abdomen. The opening is closed to prevent another hernia. A hiatal hernia is a type of diaphragmatic hernia, which is an abnormal opening in the diaphragm. The cause is unknown, but children are usually born with them. They are often associated with digestive problems. Symptoms include heartburn, swallowing problems, chest pain, and burping. In some cases, there may be no symptoms at all. Treatment depends on the individual case. Many hiatal hernias resolve on their own. If the hernia is more serious, surgery may be necessary. If your baby's belly button sticks out prominently, it could be an umbilical hernia. These are the most common types of hernias in babies and children. They occur in 15 to 25% of newborns and are more common in premature and low birth weight babies. It's also more common in girls and Black African American babies. An umbilical hernia is a weakness or small opening in the abdominal wall around the belly button. Some intestinal tissue sticks out when baby coughs or cries. This type of hernia occurs during fetal development when baby's abdominal muscles are forming. Before birth, abdominal muscles separate in the middle where the umbilical cord enters the body. After birth, these muscles usually close up. When they don't, it leaves a space for the intestines to protrude. Even though an umbilical hernia may be present when baby is born, it may not be evident until baby is older. When baby cries, the hernia will stick out farther. It looks a little like a small balloon under the skin. It retracts when you gently press on it. You can try diapering baby in diapers that cover her belly button. Fasten them tightly to help close a small umbilical hernia. Your doctor will advise you. Most cases of umbilical hernia that appear before baby is 6 months old don't need any treatment. They close up on their own within the first 2 years or by the time the child is 4 to 5 years old. Your doctor may recommend waiting until then to do any surgical repair. An umbilical hernia larger than 1 inch in diameter may eventually require surgery. This is especially true for a girl because this type of hernia could cause problems when the girl gets pregnant as an adult. Your pediatrician will advise you. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram. If you'd like to read about baby, check out our book, Your Baby's First Year Week by Week. We cover many subjects dealing with baby in a weekly format, and each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list.